Let's clear up a common misconception. Those dark spots on your nose? Blackheads aren't trapped dirt. They are open comedones, a mixture of natural oils and dead skin cells that have oxidized and turned dark upon exposure to air. And pimples? They aren't a sign of being dirty either. They are inflamed micro-wounds, your body's immune response to bacteria that has become trapped within a clogged pore. Understanding this difference is the first step toward treating them effectively, without causing more harm than good. Today, I'm guiding you through the CLA R Cycle 2.1. This isn't about harsh scrubbing or aggressive picking. It's a gentle but ruthless sequence designed to work with your skin's natural processes. We'll strategically melt away plugs of hardened sebum, safely remove only what is ready to be released, and most importantly, keep your delicate skin barrier calm and intact throughout the entire process. This is about smart, consistent care, not a one-time attack. The CLA R cycle is a comprehensive roadmap. Each step is intentional and builds upon the last. We begin by conditioning the skin with warmth to soften pores. Then we liquefy and lift impurities using a targeted double cleanse. Next, we exfoliate smart, mapping our treatment to specific zones. We attack inflamed spots with short contact therapy to minimize irritation. We'll cover how to release blockages safely, with an emphasis on optional, gentle extraction. Afterwards, we calm and coat the skin to support healing. We yield inflammation down with cooling techniques. We'll establish a cycle for your nights to maintain progress. We'll touch on crucial lifestyle wins that support clear skin from the inside out. We'll set realistic expectations for results. And finally, we'll remember the essential rules to keep your skin healthy for the long term. Let's begin. 2-3-min warm towel, steam on nose, sides, chin to soften oxidized sebum. Warm, not hot. Optional bowl, green tea for soothing. Heavy SPF makeup, quick micellar swipe first. Info drop, heat doesn't open pores. It softens contents, helping cleansers and acids work better. Silky oil, milky rinse, airy gel. Oil cleanse, 60s on dry skin, creases, sides, tip, chin. Emulsify milky, rinse. Gel, foam cleanse, 60s with salicylic, BHA, or soothing heart leaf or green tea to sweep inside pores without stripping. Glide check, skin should feel slippy, not squeaky. Squeak, barrier stress, rebound oil. Blackhead map, nose sides, chin. BHA 0.5 to 1%, 2-4x week PM, press. Don't rub, oil-soluble dissolves in pore plugs. Sensitive zones, PHA, LHA, or gentle lactic 1 to 3x week. Enzyme swipe 1 to 2x week. Mix a pinch of papaya pineapple enzyme into cleanser for 45s to digest the dead cell cap. Skip acids on retinoid nights, no gritty scrubs, micro tears, mouse easier reclogging. Short contact benzoyl peroxide 2.5% wash on oily, breakout prone areas for 60-90s, then rinse. BP sensitive? Use sulfur 3 to 10% thin layer 5 to 10 mnn, then rinse. Follow with zinc PCA or niacinamide 4 to 5% on T-zone for oil balance. Welcome to the optional step, safe at-home extraction. Before you begin, cleanliness is critical. Your skin should be soft from a warm shower or steam. Sanitize any metal tools with rubbing alcohol. If using your fingers, wash your hands and wrap your fingertips in clean tissue to prevent skin damage and bacteria transfer. For blackheads, use the lift and roll technique. Gently stretch the skin taut. Place the extractor loop just past the blackhead. Then, with very light, even pressure, roll the tool back over the pore. The goal is to ease the contents out in one smooth motion. For whiteheads, use the cross compress. Hold 2 cotton swabs at a 45-degree angle on either side of the spot. Gently press down into the skin, then roll the swabs up and away from each other. This creates pressure from underneath. Never squeeze horizontally. That causes trauma and scarring. Now, the most important guideline. The rule of twos. If the spot doesn't release after 2 gentle attempts, you must stop. Forcing it causes micro tears and can lead to dark marks. Listen to your skin and abort the mission. Some things are strictly off limits for DIY extraction. Deep cysts, milia, and inflamed ingrown hairs. These require professional intervention. After a successful extraction, cleanse the area with a non-alcoholic toner. Apply a tiny dab of a spot treatment like salicylic acid. Finally, cover it with a hydrocolloid patch to absorb fluid and protect the skin as it heals. After any extractions, your skin is in a delicate state. The goal now isn't to attack, but to support its recovery with a three-part strategy: soothe, seal, and shield. This layering process creates a protective cocoon, helping your skin heal efficiently without triggering more inflammation or rebound oiliness. Let's walk through the correct order and product choices for this critical phase. First, we soothe. Apply a calming toner or essence immediately after cleansing. Look for ingredients like Centella asiatica, also known as cica, to aid healing, heartleaf to reduce redness, or panthenol to support your skin barrier. Gently press the product into your skin with your palms. Avoid wiping, as the friction can cause unnecessary irritation on freshly treated areas. This step provides the initial layer of hydration and calms immediate inflammation. Next, a single targeted treatment. Choose only one. If your primary concern is oiliness and congestion, apply a thin layer of a 4 to 5% niacinamide serum. For post-inflammatory marks and persistent redness, a thin veil of azelaic acid over the affected zone is more effective. And if you're dealing with a specific active whitehead, spot treat that area only with a 2.5% benzoyl peroxide or a sulfur-based product. Less is more here. We're treating, not overwhelming the skin. Now, we seal it all in. Use a lightweight, non-comedogenic gel moisturizer. Heavy creams can feel occlusive and potentially trap heat or clog pores. A gel formula containing ceramides and hyaluronic acid provides the perfect balance. It delivers essential hydration to prevent your skin from overproducing oil in response to dryness, a common issue known as rebound oil. This step locks in your treatment and rebuilds your moisture barrier. Finally, and most critically for your morning routine, shield your skin. Apply a broad-spectrum, non-comedogenic sunscreen with at least SPF 30. UV exposure is a major enemy of healing skin. It darkens post-acne marks, making them harder to fade, and it can oxidize sebum in your pores, leading to more blackheads. This final coat is your daily armor, protecting your progress and preventing future damage. For treated spots, no scrubs, no sauna, no retinoid for 24 to 48H. If tender, ice roll 30-45s, twice on day 1. Makeup? Prefer light mineral base, clean tools only. Split screen ABC overlay, Night A, BHA zone press, soothe, gel moisturize. Night B, adapalene, retinoid pea-size for whole face, moisturizer, normalizes shedding, fewer future plugs. Night C, recovery, barrier serum only, don't stack retinoid plus strong acids, plus leave on BP in the same night. Pillowcase 2-3x week, phone wipe daily, cleanse within 10-15 min post-workout. Wash brushes weekly, avoid heavy occlusives on the T-zone. Hands off. If you want to touch it, patch it. 24-48 hairs, flatter whiteheads, calmer redness. 7 to 10 days, smoother nose, chin, fewer fresh plugs, oil more balanced. 4 weeks, visible drop in Blackhead cycle with CLA R Cycle 2.1 plus night rotation. Sanitizer skip. Rule of 2s on extractions. SPF daily even indoors. Drop it if you're starting tonight. Comment your skin type plus toughest zone, nose, chin, jaw, and I'll pin a custom mini map. Like, share, and subscribe for barrier-safe routines that actually work.